and you go to like them for like your shots, your pre-employment screenings and stuff like that. Or if you get hurt, workers' comp, they evaluate you and things like that.
Awesome, perfect. Yes. So like if you go work in a hospital, they'll have an occupational health department. And just like LaShawn said, that was perfect. They'll do your pre-employment screening, make sure you have your immunizations. They'll draw your blood for titers. Um, some occupational health departments will also do like blood pressure screenings, cholesterol screenings. Um, and then, like LaShawn said, if you get hurt on the job and you need to, go out on workers' comp, they're going to be able to help you with that as well. So they'll, other things they may conduct workplace assessments to learn about work processes and the material, the requirements that are, part of various jobs. They'll look for any actual or even potential hazards that may be present. They'll look at the work practices of the employees as well, looking at to see what the effectiveness of safety education and equipment. Some may come out and do hand washing audits, right? To see if people are, washing their hands in between in between patient care. Um, and looking at the safety of equipment and other practices that occur. So who was it that mentioned OSHA? I think it was Sarah. You mentioned OSHA. So what is OSHA?
Isn't it Occupational Health Safety Administration?
Yes, it is. Absolutely. And so anybody know what the purpose of OSHA is? I know it's safety. But what are some things that OSHA would require a facility to comply with?
Like having like hand washing sinks versus like I've like all I could really think about like at the moment is like hand washing sinks versus like dumping like your food versus like drink sinks.
Okay. All right. So, um, OSHA is, also the ones that make sure that organizations like hospitals and um, and I say hospitals because, right, we're going to be nurses. And so, that automatically goes, but making sure that the equipment is safe, that the employees are safe, that we have our personal protective equipment to work with our clients or our patients. So they're really big, but they're big for worker safety. So, a lot of people like, oh no, when we think of inspectors coming into the building, right, we all like want to run the other way. But OSHA is there to make sure that the organization is providing safe equipment and, protective gear for their employees.
And
Um,
like equipment's up to date,
right, that
like
it's
not expired.
inspected. Very good, absolutely. Perfect. Um, so the and it's not just healthcare that has occupational health. Like I said, I was just using healthcare because we're going to be nurses. But think of like any other organization, that may
I was thinking like
require.
restaurants. That was my
Mhm,
first thing. Like you can't wash your hands where you like dump like your cups or whatever.
right. Even, factories. We dealt with OSHA when I was in the Navy. So any organization, there are going to be specific OSHA requirements that need to be met. So with occupational health, we have occupational health nurses. And again, they do the like your pre-employment screening, making sure your immunizations are up to date. They offer immunizations. They will do your titers for you to make sure that you know to check your immunity status. And like I said, they also may do other types of screenings. Just depends on what is offered at your, you know, at your organization. So they may do like blood pressure screenings and cholesterol screenings. In some cases too, they may do flu tests, strep tests, that kind of thing. It really just depends. But an occupational health nurse is going to see injuries and diseases that we can get, you know, we can get as an exposure at work. You know, there's risks no matter what job you work at, whether it's a restaurant, whether it's in healthcare. So what is the number one injury for nurses? Anybody know?
Back injury. Back.
Back injuries. I know it absolutely. And why do we get back injuries?
The restraint on patients or lifting heavy objects.
Yeah, moving people.
Right. And poor body mechanics, right? That's why we spend so much time teaching you guys proper body mechanics when you're in your labs and your foundations classes, like how to turn and reposition people, how to stand, always like making sure that the bed is at working level, right? So they'll see those types of injuries. Needle sticks, right? That is another potential one, not just for nurses, but think of, you know, people in the OR working with sharps, getting, you know, potentially cut with the sharps in the OR. And then of course there's always exposure, right? So whether it's from blood and, you know, bloodborne pathogens, there's also other things out there. Like I was talking to another one of my friends who lives in a small town. They had a smallpox exposure, right? So occupational health will be the one to work that exposure as well. Um, you know, think of other things that you're exposed to within healthcare, you know, things like scabies and lice and bed bugs and all the other potential exposures. And so they're going to be the ones that you go to if anything should happen. Again, no matter where you work, right, there's going to be risks involved. So when we look at occupational health nurses, some of the other things that they will do, educators, right? Education about proper use of equipment, making sure that you know, that we're using all of the safety controls that are available to us, right? Even from, you know, look at your needles that we use to give injections, start IVs, right? A lot of those safety features that are built in, making sure that they're used appropriately, that the sharp boxes are being utilized, that they're not over full. There also work as case managers. So I think it was LaShawn was mentioning earlier that, oh, I forgot what I was gonna say. That's crazy. Oh, workers' comp, right? So if you get injured on the job, right, you're gonna go to occupational health and you'll have to work with, you know, workers' compensation. And so your occ health nurse will be like a case manager. They also will, you know, to help you with that process. They also, you know, are kind of a go-between between corporate and other consultants regarding equipment issues and other issues that they may see. So there's a wide variety. They even may provide counseling as well as crisis intervention in some cases. health promotion, how to reduce risk. But they have a variety. And then of course there's always, their accountability, and keeping track of, large numbers of employees, making sure that the employees are all compliant with things that they need to be done is that they need to do as well. Um, so they also may work with, helping employees fill out their FMLA paperwork, short-term, long-term disability type issues as well. What do you think would be, so I mentioned that occupational health nurses also may work with your counseling and crisis intervention. What do you think would be some crisis or counseling intervention that may need to be done?
Disasters.
Okay, they may work with disasters. Think of,
Like a mental health crisis, maybe.
yeah, like a mental health crisis, right? We're human, right? And so, you know, people have psychosocial needs, substance abuse, right? Working, impaired nurses, that either come to work, impaired or are, caught diverting medications for personal use, right? That, OC Health may be the ones that are going to do the drug screening, the alcohol screening, um, and then of course, helping them to find some community resources. They may also do the follow-up for them as well. So that's, they have a wide variety of responsibilities depending on where you're working and what that organization is going to offer. They also can even provide, so like I said, they may do some blood pressure screenings, they may do some cholesterol screenings. So they'll also provide education about lifestyle changes, and other things to help lower the risk of disease, and injury, creating an environment that, provides a sense of balance between work and family and personal and health and other psychosocial concerns. They may offer things like smoking cessation, maybe not, like what are some ways, or resources for quitting smoking, fitness and exercise, nutrition, weight control, stress management, because nursing's not stressful, right? There's nothing stressful about nursing. It's all just peaches and cream, right? But so stress control may be something that, some people need. Again, monitoring some of your chronic diseases, and even how to use some of the medical services, may be part of their position, their job as well. And then the legal and the regulatory compliance. So of course they are going to have to make sure and work with OSHA, to make sure that everything is within compliance, making sure that the equipment, they're not going to be the ones to go out and do the maintenance on the equipment, right? But they're going to make sure that the employees have the equipment that's necessary, and working with other departments within the hospital to make sure that it's safe, that it's running appropriately. And then they'll do detection, hazard detection. So what are some, we talked about needles, what are some other hazards that you may come across, in the healthcare environment?
PPE, gowns and masks and the rank signs.
PPE. So COVID that, brought to light a lot of things, right? And working in, when COVID, You saw the stories where people that organizations ran out of PPE, right? They didn't have the appropriate gowns and masks. So that would be another OSHA requirement, making sure that we have all of that, available
Signs
to
for
us.
wet floors.
Say that again.
Signs for wet floors, maybe.
Signs for wet floors, absolutely, right? So what happens if, whether it's a staff member or a visitor, right, comes in and hits a wet floor and falls and gets hurt? What other things can you think of that are potential hazards within healthcare?
Sharps not being properly thrown away.
Okay, sharps not being thrown away properly. That's a good one. I've actually accepted, I work in long-term care, primarily, do skilled rehab. We've had patients come to us, and, when they get transferred off the stretcher, I've found needles, syringes, all sorts of things kind of up in their bed sheets. And I'm like, oh my gosh, fortunately, nobody has ever gotten hurt, but be careful with those sharps. Making sure that the equipment's not working, that the equipment's working properly, right? That the cords that get plugged into the wall aren't shorting out. Chemicals, right? There's chemical exposures, even from your little purple top wipes to cleaning products. Chemotherapy medications are particularly caustic. So what are some of the control measures, right, for mixing those medications? Ventilation systems, right? The list can go on. And
Signs when, like, oxygen's in use, I guess.
right, oxygen in use signs. Right, so the plan is, working with not just OSHA, but with your occupational health nurses. How do we reduce, the accidents, and develop plans to prevent work-related injuries and accidents. And it's groups of people. It's not just individuals, right? We have to look at the groups of a whole, and take that into consideration, listen to the employees, what are some of the things that the employees are seeing. So there's a variety of wonderful things that occupational health nurses do. And of course, they're going to be the ones to, call and tell you it's time to get your flu vaccine, or it's time for your tuberculosis, your PPD, or your tuberculosis screening. And usually there's some sort of an annual requirement. So with all of that, all right, so a bunch of information, so hazard detection, they work as, hearing for, sorry, ill and injured workers. They do screenings. They're go-between OSHA. They help with, your FMLA, and your, what's it? Oh my gosh. That the workers' comp, sorry, short-term, long-term disability. They will offer crisis and counseling, health promotion, reduction. So give me an example of a primary prevention measure for occupational health.
Getting your vaccine.
Okay, vaccines, absolutely, primary prevention, right? Even, we also talked about diet education, smoking cessation, how to prevent some of the work-related injuries, especially related to body mechanics, right?
I was gonna say they have those like little videos that you can watch and teach you how to properly move and bend and all that kind of stuff.
Right, absolutely. Absolutely, right? So we try to avoid those wonderful back injuries, right? Making sure that we know how to don and doff our personal protective equipment, right? What's the proper procedure for putting it on, for taking it off? It also could be education about, healthy diets and, getting enough rest and what else? Getting enough exercise, right? So there's a wide variety that would fall under primary. Then what would be secondary? And then cover a whole lot of secondary, but what do you think would be secondary for our occupational health nurses?
Like annual screening.
Okay, annual screenings.
Getting
Um,
tested when like after they leave for whatever infections they may be getting exposed to.
okay. All right. Some may do hearing screenings too, right? Think of some your that work in some of the louder areas with some of more heavy equipment. Anybody ever been in an MRI? Anybody ever had an MRI? Those things are loud.
They just do
Yeah.
for so
Right.
long too.
I
Oh
know
my
if
God.
in MRIs are forever. I feel like they take forever, right? So, working in those areas, right? There is potential for hearing issues. Like I said, they also may do some blood pressure screenings, cholesterol screenings, stress screening, screening for burnout, things like that. That's where that counseling would come into play. And then what about some tertiary issues? What would be, or tertiary prevention? What would be some tertiary prevention measures for OC health?
Taking your prescribed medications, like if you have high blood pressure, taking your medications. If you have depression, taking your medication.
Okay, following up with their treatment plans. Good job. Working with, employees that have been injured on the job as well, right? So if they, maybe had a back injury or, something else along those lines, right? How do we get them, back to work? So limited duty programs, um, and then of course, how to prevent those accidents from happening again, right? So your OC health nurse there's, like I said, there's quite a bit within their job description. Um, so a lot of that to do. On the other side of this, we have environmental health. And so environmental hazards are responsible for about half of the total burden of disease in the world and contribute to about 80% of our communicable and our non-communicable diseases and injuries. And so think of some of, I don't know if anybody has started their vulnerable populations projects, but just think of some of the things that are out in our environment that are potentially dangerous to us. Children are going to be more vulnerable to environmental hazards. They are more likely to lead to adverse health outcomes, especially during that fetal development. And then, of course, after birth, we have to look at environmental hazards and how that would affect their growth and development. And your environmental health is it is determined by genetics, your socioeconomic status, and then environmental exposures. So
Smoking,
go ahead.
cigarette smoking.
Cigarette smoking, there you go. I was going to say, what are some environmental exposures? Absolutely, cigarette smoking would be
Alcohol,
one.
like when kids are like fetal alcohol syndrome.
Fetal alcohol syndrome, absolutely, or even to your, drug addicted mothers, right? What are some other environmental hazards?
I also think of like if someone doesn't like live in a clean house, like just the germs that can be exposed to somebody can make them sick. That's what I
Okay, okay, absolutely.
like hoarders.
Quarters, yeah. Yeah, quarters, because you never know, right, between or what could be underneath all that stuff. Let's just put that there. Other things, just think about going outside. You have traffic pollution, you may have factories or live near like shipyards, right? So there's pollutants in the air. Um, why do you think why would socioeconomic status influence environmental health? Why do you think that socioeconomic status affects that?
Access to healthcare, access to medicine.
Access to healthcare, access to medicine, absolutely.
And then like an example, I think of like my sister had Section 8 housing in this town called Trainer, PA, but it was right by the refineries. So like a lot of like the smoke from the refineries and the what are they called where all the trash goes? Like the I can't my brain's not working today, but like
Like the dump, like a trash
kind
dump?
of, yeah.
Okay.
So like you could smell like all the garbage like where her houses was, but
Mm,
like that's all she could afford at the time, like living in poverty. So like, that, you know, affected everybody.
absolutely. Who has anybody ever seen the movie Aaron Brockovich? Nobody has ever seen the movie Aaron Brockovich.
I've heard of it, but I never saw it.
So I can't remember. I know Flint, Michigan is one area, and there's more areas where and I think it was like the electric company or something along those lines. Anyway, there was toxins that were being inappropriately dumped into the ground, and the it was well, not uranium, but it was a similar got into their water. So got into the groundwater, and there were cancers and all sorts of illnesses that occurred because of that. Um, and it was because of the improper disposal from the company. And there's other areas that are affected. And this, like it was, we're talking about large towns and a lot of people being affected. Um, what about, too, when we look at lower socioeconomic status, living in more crowded conditions, right? They may have, quite a few people living in a small
It
area.
can spread faster. Like if, you'd live in a house, like a 3-bedroom house, but in those bedrooms you have like 4 people in one bedroom, one person gets sick, then everybody gets sick.
Right. So yeah, that increases our risk for communicable diseases, right? So like you said, one person gets sick and it's going to spread through it. Just think like a nursing home or a prison or something, right? You put a whole bunch of people in a small confined area, one person gets sick, right? Or somebody brings something in and it can run through that whole facility. They have poor quality foods available, right? So they may not have access to fresh fruits and vegetables, whether it's because of cost or it could be the lack of availability of grocery stores, um, more hazardous jobs. They also may live in older homes with that lead-based paint, right? So we have to worry about kids and their lead exposure. They also may live in areas that the schools, the daycares also may be older too, right? So we always talk about lead-based paint, but there are other issues too, like asbestos and things too that may still be present that can cause significant damage. Um, and then of course with the genetic predisposition, there's also, family history of some of those non-communicable diseases that are related to environmental hazards, like your developmental delays, autism, asthma, right? And other issues. So when we're looking at just like that vulnerable population project, right? When we're looking at, a particular area, like when you're doing your windshield survey, we're looking at where people live. And then where they work, where they go to school or where they send their children to school, right? So this is that windshield survey. We're driving around, we're looking at the community, we're kind of seeing what's going on and what the buildings look at. So where they live, where they work, where they go to school are important because they live in a house that doesn't have any issues with lead-based paint. But if if your child is going to a school in an older building, or if you have somebody that, is working in a potentially hazardous area, right, then we can bring stuff home. Think about coal miners and some of your other factory workers, where they may bring dust and debris on their clothes, right? And that can potentially be a hazard for family members when they come home. Um, Dietary history is also important. Think of pesticides in our food, on our foods, right? Or even using pesticides around your homes. Was going to say. And then, of course, like I said, the drinking water is always going to be an issue. So do they have access to clean water? Generally speaking, here we, have most people will have some sort of a city water, but think about patients that are, live out in more rural areas that rely on well water and septic tanks. Anybody work with well water? Anybody have well water? No. Um, so when I lived in New Jersey, we lived in the middle of nowhere on top of a mountain. But we had well water and we had a septic system. And so learned that I don't like the taste of well water. I never have. But it's important to take that into consideration. When I was in my bachelor's program, I spent some time, it was actually pretty interesting. For my community class, we had clinicals. And so I spent a week at the health department, just at various, areas of the health department. But the one morning I spent, was with these three nurses. Their job was to go out and assess new areas, like if they were doing any kind of like a new house construction or a remodel or things like that. Long story short, they went out to assess where to place the septic versus the well, right? So especially if there's any kind of incline, right? You don't want your well down here and your septic up here, because if the septic leaks, what's going to happen? You're going to get that waste that's going to leak into your well in your drinking water. So it's just an interesting, I mean, and I didn't, up until then, I probably never even would have thought about it. But that is a potential hazard, right? If your septic is leaking into your well water, that can be, cause some serious health issues. Other things like Sarah was saying, dumps, your garbage dumps or dump sites, right, could be potential hazards to a community. What else? Factories within the area. Factories are going to, there's smoke and there's other, environmental pollutants from factories that could potentially cause issues, not only with the water, like I was saying, but within the air as well. Major transportation routes. So think about, and I hate this, but think about living right next to an interstate, right? That's, there's a lot of, gas exhaust, or even think about your patients that are potentially traffic workers or construction workers working on the interstates, and having exposure to all that exhaust all day. Airports too. Lots of, exhaust and things that come from airports. Um, and then when, part of that windshield survey too is, looking at the age, the condition of the housing, any exposure to trash, pest problems. I grew up in Brooklyn. There was big pest problems in New York. But think of mice and rats and bugs and other things. And then in your rural areas, do they spray pesticides and herbicides by plane? Has anybody ever seen that? Where they fly over, and it's a easier way for them to like dust their crops. So they can fly over with the pesticides and the herbicides over like large periods, and it's just like a spray. And obviously if it's, the wind can pick that up, it can spread. So those like in the Delta in Mississippi, they have high rates of disease, because there was a lot of spraying of pesticides and herbicides by plane. With your lead-based exposure, again, those are in your homes prior to 1978. Young children may eat paint chips, but it usually, the exposure comes from like renovations. The lead dust from your lead-based paint, for some reason has a sweet taste to it, which is what encourages them to actually want to eat it. Trying to think of what else. Children, again, they're going to be more sensitive, because of their, undeveloped liver. They generally consume more fluid and foods, which increases their risk for exposure. But your exposure to lead can cause cause premature birth. It can lead to learning disabilities in kids. It can lead to hypertension in adult patients. Thinking of our water. So what are some potential pathogens that we can find in our water?
I don't know.
Maybe like E.
So
coli or something.
say that again.
E. coli.
E. coli is one. 30 million Americans drink water that doesn't meet the EPA safe drinking water standards. That's pretty scary, right? The 50% of Americans live in areas where air quality does not meet national standards. So air pollution is associated with asthma, respiratory disease, cardiovascular disease, cancers, reproductive health problems, neurologic problems, birth defects, and indoor air is also affected by things like carbon monoxide, dust mites, molds, cockroaches, mildew, cleaning products, lead, tobacco smoke. So there is lots of potential hazards out there. Food contamination. So think of things like salmonella, Campylobacter, E. coli, and then of course your, pesticides on your fruits and your vegetables, the hormones and the antibiotics and the meats, right? So there's a lot of things out there that are potentially dangerous, and can cause issues. How do we prevent, what would be one way that we could teach to prevent some of those food-borne illnesses from occurring?
Cooking your meat to the proper temperature.
Cooking your meat to the proper temperature. What else?
Washing
Hand
your
washing.
tools.
Hand washing, absolutely. And
Making sure your
even like,
surfaces are clean.
say that one more time,
Making
Michelle.
sure your surfaces are clean. Your
Right?
cooking area.
What about even how we thaw our meats, right? And I have done this myself, right? You need to pull something out for dinner, you throw it on the counter and you kind of just let it defrost at room temperature, hoping for the best, right? Not the proper way to thaw meat, right? We want to thaw it in the refrigerator rather than, sitting on the kitchen counter. But even making sure that we're cleaning up, right? I was watching this one video about it was an infection control thing, but it was with cooks. And the cooks were messing with chicken, and they did that, like that stuff that kind of shows how you wash your hands, like that glowy stuff. And even after washing their hands, they still had byproducts on their hands and it had splashed on other areas. So making sure that we're cleaning up right after we're preparing, and just teaching them those wonderful, food handling practices. And so that brings us to education. So patient education, we know as nurses, patient education is going to be one of the most important roles that we will fill as nurses, right? We use it to promote health, to prevent illness and injury, improve health-related behaviors, and then, of course, to enable our patients and our families to care for themselves. And so when a person takes responsibility for their health, they're more effective at making change and maintaining that change. So education is empowering, right? It gives them knowledge, it gives them, motivation to, really take personal responsibility and make those necessary changes within their life. One of the most important learner related barriers is something called low literacy. And so we as nurses are often going to deal with patients or people that are illiterate or have low literacy levels. There are still people here in the United States that cannot read and write. And it may be embarrassing for them to admit that they can't read or write or that they have a lower literacy level, and may not admit that to healthcare providers or educators. And so they may appear to understand things and they really don't understand. So one way that we can assess their literacy level is to hand them a printed instruction sheet or something along those lines and have them read it back to us. And so that may help us to identify those that don't have that reading ability. And then, having them actually reading, right, helps us to know if the patient can actually comprehend that material as well. Assessing their mode readiness to learn as well. Motivation plays a huge part in effective learning. So like I said, I work in skilled rehab. And so a lot of these patients are recovering from, things like strokes and heart attacks, as well as, the hip replacements and knee replacements. But they have to want to learn how to make necessary lifestyle changes so that they can live, a healthier lifestyle and potentially not have, another heart attack or something else that occurs. And so we have to be able to, find their motivation, encouraging them to learn and to make necessary changes within their lifestyles to prevent further episodes from occurring. Um, that's probably one of the hardest parts. Think about your 70-year-old patient who's a newly diagnosed diabetic, and we're telling them that they have to make all these changes to their diet, their exercise, right? They can't eat all the same foods that they've been eating for the last 70 years, right? So motivation is something that we may have to try to find and help build upon. We also have to look at their cultural values and their personal expectations. Because too, remember, your cultural values may not be the same as, hold on 1 second. The cultural values may not be the same. So we have to look at that and take that into consideration when we're providing their education. And it's hard, just like I said, that 70-year-old patient, we're telling him he's got to make all these diet changes. What if they have, treatments? Like, what if they have to give themselves injections or, change a dressing, provide wound care for themselves? That can be overwhelming. It can be scaring. They may not feel like they can learn that or have the ability to do that. And so, how do we get people to build their self-confidence in order to be able to care for themselves or even care for a loved one? Your Healthy People 2030. I don't know how many people have looked at that. There's a lot of objectives that are related to education. It is also one of Joint Commission's big pushes is to make sure that documentation is provided to our clients as well as documented. So how do people learn? What are the 3 different ways that people learn?
Auditory, visual, and physical, like doing.
Yep, visual, auditory, and kinesthetic, right? So visually, what you see, are auditory is what you hear, and then kinesthetic, right? That's that hands-on. How many of you have done like a learning skills inventory to see how you learn best? Has anybody done one before?
No, I've wanted to.
Yeah, it's interesting. So, most people can learn by any of those. One route is usually dominant in somebody. So usually you're more verbal, you're auditory, or you're more hands-on. With that, we have 3 different domains of learning. These are the parts that are used for learning, and it's very similar, but these are cognitive, affective, and psychomotor. Cognitive, excuse me, is the thinking part of the person, right? That's the ability to hear or read information, to understand information, to memorize it, and then use it later to solve problems, right? So we do a lot of that in nursing, right? You read information, you memorize it so that we have it for later use. Your affective is the feeling part of the person. It's the attitudes, beliefs, the values, how in attitudes, beliefs, and values affect how you learn as well, right? So just like our 70-year-old diabetic patient that I'm telling him he's going to make all these lifestyle changes, right? How do you think that's going to make him feel? Right. So there's a huge affective part to learning. Why do I need to know this? Why is this important to me? And then the psychomotor, that's the moving part. That's learning a skill, and then having the ability to perform the skill. Have, practice the skill. So one of the things that we do in nursing as nursing instructors, or something that I would do when I was in the lab, I used a see one, do one, teach one approach. All right. So, and I use this with my patients as well when I'm providing education to them. If they have something they need to do, whether it's check their glucose levels, give themselves an insulin injection, whatever, they're going to watch me do it, right? So I'm going to show them how to do it. Then they're going to do it, right? So sorry, my doorbell rang. And then they're going to teach a family member, close friends, whatever, how to do that procedure. So the C1, D1, do one, teach one is going to be that psychomotor. That is how we reinforce, right? The more you do something, the more ingrained it gets in your head to do it. If education doesn't address all three domains, they're not going to be as effective. So if we tell someone they have to change and they aren't motivating them to do so or giving them the skills, then that change is not going to be effective. So who does the initial education for our clients? Who provides the initial education?
The RN?
The RN's going to provide the initial education, right? And then as the LPNs, you'll go and you can reinforce the education that was provided. And where do we get the ideas for that education? It can come from a variety of sources. It can come from nursing. It can come from therapy. It can come from social services, right? So, anybody that's involved in that patient's care might have some information regarding what education needs to be provided. And then we will develop a education plan for that client. The ultimate goal of any and all patient education is prevention of illness, wellness promotion, and to restore health. And so, some of the teaching, obviously, that we're going to provide would be things like, what's the disease, they may need information about what disease they have, the disease process. They may need, information about surgical care, self-care. And so again, I can't reiterate, education is such a huge part of what we do as nurses. And so we have to kind of look at the whole person. How do we motivate them to make the necessary changes in order for them to live a healthier lifestyle, and to prevent maybe, future issues related to that disease? So we'll bring it back to primary, secondary, and tertiary. What are some primary prevention measures for education? What are some primary prevention? And no, that we'll throw vaccines out. So give me something other than vaccines for primary prevention.
Diet, exercise, like even
Okay.
walking 20 minutes a day, maybe.
Okay. Diet and exercise. That's a good one. Say that again.
Educational pamphlets.
Okay, educational pamphlets. You ever go to I asked this to another class and they all looked at me like it was crazy. In my doctor's office, on the wall in her exam rooms, there's like this thing and it has like all these different pamphlets in there for like hypertension, smoking cessation, cholesterol. Does anybody else's doctor's office have those? No? Oh. I think that's why people always look at me like I'm crazy. But yeah, So, that's a good one. Of course, immunizations, right? We know that. Um, you know, um, Parenting, right? So some things for parents, like how do we teach parents to, we role model healthy eating,
Coping skills for stress for parents, maybe.
coping skills for stress? Absolutely.
How to deal with like a baby that won't stop crying.
Yes, right. Especially when we think, about our pregnant adolescents, right? How do we teach them to deal with the stress, right? So making sure they understand normal growth and development, right, of their kids. Um, it could be teaching women to void before and after sex to prevent, urinary tract infections. What would be some secondary prevention for education? And there's so much that can fall in there. So whatever you got.
Getting a little mammogram or the pap smears.
Right, teaching them about, right,
And
making
like the
sure.
importance of them and like saying like, yeah, it's gonna hurt, but it's quick.
Okay, perfect. Yeah. So getting, the importance of getting the mammograms, the pap smears. Um, what about colonoscopies, right? And your prostate screening for guys. It could even be teaching signs and symptoms of a disease, what to look for. So like the signs and symptoms of a urinary tract infection, or, having diabetics check their feet every day, right? To make sure that there's no issues. And then what would be some teaching tertiary prevention measures? This is the hard one, right?
I guess like medications.
Okay, so we can provide education about medications, right? So let's take my 70-year-old diabetic patient, right? How to use a glucometer, right? Why does he have to make those dietary changes? Or,
Educating that person to go to the podiatrist to get their toes cut rather than cutting them at home.
oh, that was a good one.
And like
Yeah,
the importance of
absolutely.
that.
That was a good one. That was a good one.
Thanks.
Um, what about, our hypertensive patient, teaching them about the DASH diet or low sodium diet, right? Trying to think of what else.
Keto.
Say that again.
I said the keto diet.
The keto diet, Mediterranean diet's another one, right?
Or if
That they
somebody gets diagnosed with like celiac disease, the importance of removing like the gluten and how it can like affect them.
That was all. Yeah, good. That's awesome. Yes. So all of those things would be tertiary prevention. So we learning, so we can provide all this education to our patients, right? Learning hasn't occurred until the behavior has changed. All right. So we can provide all this information. We can teach them about, their disease process. We can teach them about diet and exercise. We can teach them about the medication side effects, right? The diet changes that they need to make. But until they change their behavior, learning really hasn't occurred. You may know all this in the back of your head, right? Like nursing students, that, and I know that they've told you this at the beginning, right? You need to get rest, you need to eat right, you still need to exercise, even though you're in nursing school, right? All of those wonderful things. But until that is put into practice, right? We really haven't done anything. And so making behavioral changes is hard. Just think about any time if tried to make a behavioral change, whether it's to lose weight, to quit smoking, to quit drinking, or I eat better, whatever it is, right? It's hard. It is so hard to make a change. And it is human nature to follow the path of least resistance, right? And that includes our habitual behaviors. And so change is hard, never going to deny that. And so it is it's reinforcing, it's re-educating, it's providing all of this information to our clients in order to help make that, encourage them or motivate them to make that necessary change within their lifestyle. And that's probably the hardest part for most people. Think about something that you've wanted to do. I think they said it takes 21 days for something to become, like if you want to, if one of your goals is to, work out or lose weight, you have to do it 21 days to build that habit. If you can do it consistently every day or however often for 21 days, usually that is enough to get it to become a habit. So who knows? I don't know how true it is, but that is, but it's hard, I know with my population that I work with, and I work with kids through elderly. So I have a variety of age groups that I work with, and they're all difficult when it comes to disease processes and education. But the older we are, the more set in our ways, and it's a little bit harder for us to want to make changes. So, we have to find those motivating factors to get them to make those changes that we need them to make. All right. Any questions? Occupational health, environmental health, education. Y'all did great today. Thank you. So again, just to recap, your homework grades are on. Email me, call me, text me, if we need to schedule a meeting. Your exam review is Sunday night at 7, same Zoom link. So your exam 2 is going to be next Wednesday. You have your infectious disease group project that is due. Have y'all started your infectious disease group project? Awesome. Oh, yay. Okay. I see heads going up and down. That's awesome. Okay. Any questions about it? No? All right. So that's due next week or this week, next week, sorry. And then your exam 2 again next week, and then week 8 is quiz 5. Again, week 9 is your case study, your HESI prep, your Saunders, and then week 10 is exam 3 and your vulnerable populations project. Week 11 is HESI and Saunders. And then week 12 will meet on Tuesday. All right. If you guys don't have any questions, I will see you Sunday at 7. And then just keep plugging that in. So Sunday at 7 for exam 2 review. And then other than that, you guys have an awesome week.
Okay, I'm coming.
I have a question
Hey, did you
about
make my pen paper?
I have a question. Remember when you said you were going to review the question from our last quiz?
Mm-hmm.
So we didn't get the point.
Not yet. Hold on. So we're meeting on Saturday.